And this is why WCNC Charlotte's Kia Murray is diving into the details here, showing us how several stakeholders are seeking solutions.
It's the one thing these allies need more of.
There are not enough resources.
The resources.
Nonprofit leaders, doctors, and law enforcement gathered in this room to paint a picture of what addressing mental health looks like in South Carolina. You're looking at the Hear Me, See Me, Accept Me project that's in the works. The soon-to-be mobile mural is meant to raise awareness. And while visibility is where problem-solving starts, it's far from where it ends, especially when tackling what Katie Durkee calls one of her group's most impactful issues, crisis intervention.
When I have a person who calls me and they're in crisis, they may have called 988, which is the crisis text line, and they may have been stabilized over that period of time. They didn't need to go to the emergency room, but they've advised them to get a psychiatrist or a psychologist, or they need to go and do a step-down program. And when I talk about step-down programs, I'm talking about intensive programs, but the child goes home at night.
And that's the goal, to keep kids with their parents. But the path to that goal is littered with obstacles. On the step-down program, other organizations define it as some kind of intermediate or mid-level care for people struggling with mental health. It's for those who may not need care at a hospital but have trouble functioning in society. York County Sheriff Kevin Tolson says the lack of resources can lead to scenes like this one.
There was a 9-year-old at our local hospital in mental crisis.
When this happens, kids in crisis being handed over to law enforcement for transport, Tolson says he's left with few options. But in this situation, he was able to direct his officer to an alternative.
Put himself in civilian clothes. He went and got an unmarked police car, so it didn't have the blue lights on top. It didn't look like a police car. And we were able to let the mom ride with this child who was in mental crisis to the hospital, and then we brought the mom back.
Still, even after a crisis situation or hospital visit, there's work to be done.
And the families don't learn how they can support their children at home.
It's why pediatrician Dr. Martha Edwards has this for parents navigating mental health with their own children at home.
There are sort of 3 parts that I like to focus on with families. So prevention, screening, if there's a problem, and then intervention. What do you do if you do find a problem?
The methods Edwards talks about there can include checking out your own family medical history for mental illness diagnosis, or even coming up with daily routines for you and your child. But that doesn't take away from the bigger solutions to problems like crisis resources. These leaders talked about the need for more beds in psychiatric care, crisis intervention resource centers, and the funding to pursue them. I'm Kia Murray, WCNC Charlotte.